The author's main question behind the true profession of a psychologist is whether working in a correctional institution can cause great levels of stress, occupational burnouts, and life stress in public and non-public sectors. Psychologists, the primary providers were found to have desires of a decrease in administrative tasks and time spent performing psychological evaluations, reported dissatisfaction with limited opportunities for advancements. They also feel a lack of influence on decision making and a significant negative correlation between job satisfaction in large crowded facilities. Other perspectives of correctional workers are used to further explain the reliability of the results. The chief administrator, also called the warden, is reported to have a decrease of job satisfaction. Correctional educators are, in contrast, satisfied, yet stressed because of multiple academic skills used towards custodial staff and inmate efficiency. Similar to correctional educators, correctional nurses are satisfied by their job but have moderate levels of stress and conflict with wardens. This was all tested in a normal correctional environment. The author included 203 doctoral level full-time psychologists. Of the data collected, the levels included specifically 44 correctional, 56 Veterans Affairs, 54 public psychiatric hospital, and 49 university counseling centers that were all different psychologists within sectors. As a result of the author's hypothesis, the CR psychologists reported to have a decrease of life satisfaction compared to non-correctional peers. PPH psychologists, in contrast, had reported to have had less job satisfaction than correctional psychologists, and also have less satisfaction to overall life as well. The authors further claim an increase of occupational stress and burnout, as well as potential interventions that led to the study without limitations. Also, correctional psychologists that typically work with colleagues is seen as another step to research if it can be a potential impact towards co-worker relationships on job satisfactions. Another study of effects of employee training programs was the effect of personal identity of a psychologist being crucial. The only problems missing from the author's information was since the surveys were mailed out, some did not come back answered, leading to an unequal amount of participants that are supposed to be surveyed and a biased amount of answers. In essence, burnout was defined as a syndrome of reduced personal accomplishment, increased emotional exhaustion, and increased depersonalization. Job satisfaction was defined as individuals' global assessment of his or her life in positive terms.